Louisiana Senator Bill Cassidy, himself a medical doctor, he joined me yesterday on Sunday Morning Futures. Cassidy and Collins co-authored a bill that would replace Obamacare, but it keeps some of the most popular features. Here's what he said.
The bill that we put forward, the Patient Freedom Act, it's known as the Cassidy-Collins, actually achieves President Trump's goals that he said in the campaign. And those goals were to make sure people had coverage, care for those with pre-existing conditions without mandates, and to lower premiums. Now, if the House bill doesn't accomplish that, we don't have a score yet. I'll continue to push the Patient Freedom Act, the Cassidy-Collins plan, because it does achieve the president's goals.
See, they hide behind this idea that it hasn't been scored. And so they're not going to comment on the bill because it hasn't been scored. And so that's why they'll start from scratch.
Listen, we need competition to drive the price down, and we have all these impediments like you can't sell policies across state lines. They have to fix a lot of structural things. The Senate does that, then maybe that's a pathway to get this thing fixed.
They can't do the across state lines, I don't believe, if they want to do it under reconciliation. Right. So that's the phase 2 that they talk about, that they're going to have to wait and do that at some later date. But I think that, again, that the Republicans will so far have lost the argument, because even Republican Senator Susan Collins is talking about the pre-existing conditions. That is such a small slice of the insurance market, and it wins hearts. It wins people's hearts, but again, with the people who signed up for that initial Obamacare coverage of pre-existing conditions before the full rollout of the health insurance overhaul, it was a little more than 100,000 people. You're talking about ripping up the entire insurance industry, covering 200 million people for 100,000 people. And I know that it's important, but again, it gets this dominates the discussion when we need to be talking about everybody and making everybody's care affordable.
Look, and Nancy Pelosi started this with her 5 talking points on Thursday morning. It went out, number 1 being pre-existing conditions, number 2 being this is going to be unfair to the older folks, number 3, and that's what's dominating the conversation, and Republicans are just reacting. And we've said all throughout, if you're reacting, you're not acting. If you're not acting, you're losing, and that's what's happening right now.
But no one's focusing on is what's wrong with the existing. So open enrollment's about to start, right? And you don't know who's going to be in it and who's not going to be in it. No one's focusing on what's broken with the existing plan.
Well, we know deductibles are way up, and the cost is way up, and that's
some counties in some states can't even get coverage at all.
That's right. 94 to 99 in Iowa. Yeah.
Right, exactly, but it's not going to just be Iowa. There are other states that are at risk. Tennessee is the insurance market has completely fallen apart there. And you have already last week, which we talked about on this program, in Virginia, Anthem, 38% increase in premiums. In Maryland and Virginia, respectively, 52% and 35% increases by Care First. Aetna dropping out of Virginia. So the Trump administration is using that and will use that to its advantage to speed this along, because something needs to get done between now, not just politically, now and the end of this year.
All right, we'll keep talking about this morning.